So now we're happy to introduce Jonathon Feit. He's the co-founder and CEO of Beyond Lucid Technologies, and he's going to demo how first responders such as EMTs, firefighters, and battlefield medics are using the MEDIVIEW platform as a tool for them to collect critical information about life-threatening incidents and share that with personnel in the hospital.
Thank you very much. So the MEDIVIEW platform by Beyond Lucid Technologies. What you're seeing here is a call screen. Our system has been designed, according to one of our competitors, as the first all-in-one integrated solution for emergency medical response. What this means is that in addition to a dashboard approach, highly designed approach, what you're seeing on the left side are the workflows of the medic in the field broken out into steps. And along the bottom are tools that we've built to make their jobs easier. So let's assume for a minute that I'm an EMT arriving on scene, and unfortunately my mother-in-law has been involved in a car accident. So let's see, she's got some chest pain and she's a bit dizzy, but she's not quite nauseous. And well, let's hope she's not in labor, because that would be weird. She's a little, there's some issues there, but she's not quite psychotic. Nevertheless, she is a bit confused and having some respiratory distress. As you can see, in just seconds, as a medic, we've identified why we're on the scene in the first place. What do we need to do next is the next question. And because we built the system as an integrated solution, we can use this information plus an embedded GPS system to help route the patient to the next, or route the medic, with the patient to the right place to treat the patient, whether that's based on what's wrong with them or based on their location, for example. We are the first in our industry to incorporate a GPS system that does not require an internet connection. I am offline right now, in fact. And as you can see, turn-by-turn directions built right into the system. Now, we get into collecting that information. As I mentioned, we're using a GPS system, so we can start using those external pieces of data to start filling out the record, make it much easier than the paper-based record that more than 50% of medics currently use to fill in their information. We can identify when we arrived on scene. We can identify or bring in directly from a dispatch what happened and what we need to do when we get there. Start entering that patient's information and make it very easy to begin typing that information. For example, don't even need a keyboard, can use write directly on a screen, use a tablet, for example, or an on-screen keyboard if you wish. Collect all this information, and we're also designed to work with health information exchanges as they come out, so we can actually pre-populate the record with a patient's medical history. Do an assessment, take their vitals, for example, right there on screen. Let's assume, again, I don't want to type. I just want to write directly on the screen. It's what I'm used to. And, well, we're going to give her some Valium, let's assume. So now, as I mentioned, we collect all this information. We've identified where we need to go. We routed the medic there. What comes next is identifying who this person is. Let's assume, let's do it this way. I'm going to put your insurance information right into the system and capture all this information, then take all this information I just collected and hand it off to the next link in the chain. So the hospital or the care facility, the senior care facility or whatnot, is able to see all this information within 30 seconds. We can even bring in, for example, an ECG or other device, and again, have that show up inside the hospital even before the patient arrives. But my mother-in-law's primary language is Spanish. She's not very comfortable in English, so we can do all her signature documents right there in Spanish, incorporate all this information, and then as well as all the protocols to help caregivers do their jobs better. But the kicker here is what we do next, and that is hand all that information off to the hospital. The hospital can log into a SaaS portal, a web-based portal, does not require any integration on their end, and all the information that they just received from the field is going to be available inside the hospital. And there we go. So inside the care facility, all the information that I just collected from the field within a 30-second delay from the field. That's the MEDIVIEW system by Beyond Lucid Technologies. Thank you.